Pemba Island is part of the Zanzibar archipelago, home to more than 500,000 people, many of whom have limited access to healthcare. Neonatal mortality remains a critical issue, with rates around 29 deaths per 1,000 live births. Pemba's healthcare infrastructure includes 5 hospitals serving 4 districts, where this feasibility study will be conducted. This study will explore whether VR can offer healthcare workers the skills they need to save newborn lives.
My name is Madalena. I'm a medical student doing my master's thesis here at Pemba, Tanzania. And what we're doing is a feasibility study with some innovative new technology, virtual reality, testing out if it can improve the skills and the knowledge of healthcare workers in neonatal resuscitation. So what we will be doing is we'll do a skills and knowledge check in September, and then we will be implementing the virtual reality. And in 6 months, we'll test if it has had any effect.
The feasibility study will be conducted across multiple hospitals on Pemba Island. Healthcare workers will undergo weekly 1-hour VR training sessions focused on neonatal resuscitation, following the internationally recognized Helping Babies Breathe protocol. The aim is to ensure that healthcare workers can train without needing to leave their posts, minimizing disruption to patient care.
PHL means Public Health Laboratory Evo. This is a research institution within the Ministry of Health. It is an institution that is run jointly between Ministry of Health and Evo Foundation. PHL is also a WHO collaborating center on NTD, neglected tropical diseases. So our main activities here, as I said, it's research. 80% is research. The remaining 20% is service provision, diagnostic services to the Ministry of Health to substitute Ministry of Health effort, and the remaining part is training. So we also do in-service trainings here for lab staff.
This study is designed to explore whether virtual reality can provide an effective, scalable solution for healthcare training in neonatal resuscitation. The VR training module used in this study replicates lifelike scenarios, allowing healthcare workers to practice essential skills such as airway management and ventilation. The technical development of the VR simulation has been a collaborative process between Cora VR, clinicians, and researchers. This co-production approach has ensured that the VR simulation is both highly accurate and practical for healthcare workers, providing a realistic and interactive learning environment.
Many neonatal deaths are preventable, but it requires that health workers have the equipment they need and the skills to recognize and handle neonatal emergencies. It is a challenge to reach health workers in low and middle-income countries with continuing education programs. It requires that the skills are maintained throughout time. It is therefore really interesting and have great perspectives to use innovative technologies, such as virtual reality, to reach health workers where they are. So you don't have to remove the health worker from their setting. They can train anytime they want, anytime they have time, and where they are actually working. So the perspectives of using innovative technology in the most resource-restrained environments is enormous. And that is why this study is so exciting.
Unlike traditional methods, VR requires no physical presence, reduces the risk of infection transmission, and allows unlimited practice.
My name is Dr. Mohammed. I'm head of doctors at the hospital. You can call me as team leader for this hospital. Previously, when coming this VR project from Madam, I was medical officer in charge is the beginning of this project. So till this time, I'm just an assistant medical officer in charge here. So this project for me is good, and is best technique to assist our healthcare providers for the manner of newborn resuscitation and another aspect for pediatric and neonatal care. So this project for me is good and healthy. So I hope if there is additional opportunity to continue to extend this more than 3 to 6 months here, to get many participants or increased number of participants, including healthcare providers, is good for me. So just I'm requesting to you to get more chance for us. Thank you.